And welcome to our THV 11 special, the Affordable Care Act, Making the Right Choice. It's been debated and discussed, and now the day is here for the uninsured to start enrolling in a health care plan. Because if you don't, you will be fined for not having health insurance. Our purpose tonight, to help you learn as much as possible about how the federal health care plan will affect you. And we will walk you through enrolling in the healthcare marketplace, which started today. If you've never shopped for health insurance, we will tell you the 5 things you need to know about it before you get started. This is for anyone who is uninsured, who does not know where to start. And then for the vast majority of you, 75% of Arkansans who already have health insurance, what does the new healthcare law mean to you? What kind of impact will you see? And when will you see it? We have those questions answered for you as well. And the Clinton School of Public Service holding a kickoff event today to mark the opening of the health insurance marketplace. THV 11's Craig O'Neill live at that event tonight and joins us now with more. Craig, good evening to you.
Well, other than the obvious reason that former President Clinton has been the explainer-in-chief for the Affordable Care Act, why would they hold this event at the Clinton School of Public Service? There's a very good reason, because it involves young people and the role that this act and this law plays in their lives. We'll address that, as well as answer the question, what does this law mean to those of us, the 75% of us, who already have insurance? What changes will we be looking at? Will there be new costs? Answers to those questions and more coming up here live from this kickoff event. Dawn, back to you.
All right, Craig, and we understand the new health care law. A lot to take in, with many Arkansans still asking many questions. Right now, we have an Affordable Care phone bank set up for you with a team of experts on the other end of the line. THV 11's Liz Massey with more on this tonight. She is at the phone bank. What kind of questions are we getting, Liz?
Oh, a lot of questions, basic questions. How am I eligible? Just all kinds of questions, Dawn. And we know you have more specific questions for your family. So we have a phone bank sitting here of our experts from the Arkansas Insurance Department right now waiting to take your call and answer your questions. The phone number on the bottom of your screen, 501-244-4510. 244-4510. These professionals will be here until 7:30 tonight answering your questions. Dawn?
Liz, thank you. Now, for those still asking the question, what is the Affordable Care Act? If you're among the roughly 48 million people without health care starting today, it means you can start shopping for a plan at healthcare.gov. That's the website. There you'll find 4 competitive plans with Olympic names. Bronze is basic, silver is mid-range, and gold and platinum are the high-end plans. All must offer the same type of coverage. All will come with a monthly premium, but the deductibles and copays will vary. President Obama says for many it provides affordable coverage.
Good health insurance for the price of your cell phone bill or less.
Now, the administration puts that at roughly $100 or less per month, but that's if you qualify for tax breaks and subsidies because of income. Costs also vary based on where you live. Choose by December 14th if you want your new health coverage to start January 1st. On March 31st of 2014, open enrollment ends and the penalties begin. If you don't have health insurance by then, you could be slapped with a fine. There will be no penalties for a limited few. Now, for those who already have insurance, different rules apply. As we told you earlier, Craig O'Neill live at the Clinton School of Public Service for an enrollment kickoff. He now joins us with more on what this means for the already insured. Craig.
And Cindy Crone, who has been my go-to person and THV 11's go-to person this whole time leading up to this day, joins me, Deputy Commissioner from your Arkansas Insurance Department. Let's talk about the 75% of us, me included, who are already insured. Big day for the kickoff for enrollment, but what about us? What changes do we expect?
Well, if you're already enrolled, there aren't a lot of changes. If you're Medicare, everything stays as it is. You keep your plans.
We need to say that again, because a lot of the older viewers may need to hear that again. Say that again, Cindy.
If you are Medicare recipient, Medicare age, this does not impact you. There are no changes for you.
And for those of us with it?
For those of you with Medicare?
No, with insurance already.
If you have insurance through your employer or you already have insurance, nothing should change for you. You can keep what you have. But this is for people who have no insurance. So we're hoping to get the 500,000 in who are not in.
And real quickly, what about out-of-pocket costs and copays for those of us with insurance? You see any changes there?
There should be very little change from what you have now. You can keep what you have if you like it.
So there you have it, Dawn. For those of us with it and Medicare patients, no change. But there's more to talk about here. Back to you.
Craig, some people wondering the differences between the plans they already have and the ones offered in the Marketplace exchange. Cindy Crone, who you just saw with the Arkansas Insurance Department, says the healthcare coverage options are essentially the same. Both employer-sponsored plans and plans offered through the ACA Marketplace offer the same benefits. The difference is some people who get ACA coverage may get subsidies to help them pay their costs. And if you're deciding whether to stay with your current coverage or switch, here is one thing to consider.
If you buy employer-sponsored coverage and your employer helps with that, that is pre-tax. And so it's to your advantage if the rates are such. So that's why if you have good employer-sponsored coverage that is affordable, you are best to stay there.
Some of the required benefits available in all insurance plans include coverage for inpatient hospital stays, emergency services, maternity care, and health prevention and wellness. But then there's the other 25% of you who don't have insurance and very well may have never enrolled in healthcare before. We know you have a lot of questions. We want to help you. Right after this, we'll tell you the 5 things you need to know when it comes to open enrollment. Keep it here. You're watching our THV 11 special, the Affordable Care Act, making the right choice. Welcome back to this THV 11 special on the Affordable Care Act. 500,000 Arkansans do not have health insurance, but that is all about to change. Starting today, uninsured Arkansans will begin enrolling in the healthcare marketplace, also known as the exchange. And if you have no idea where to begin, Craig O'Neill is here to walk you through it.
You've heard of the Texas two-step made for the dance floor. But with the help of Sandra and Heather at the Arkansas Insurance Department, we present the Arkansas 5-step, made to help you understand how to enroll in the health insurance marketplace. Step 1, take a look at the prescription drugs you've been using, how many times you've been to the doctor in the last year. In other words, what are your family's health care needs?
You've got to get prepared, and part of being prepared is doing your homework, figuring out, okay, do I have any particular illnesses that I already know about? Am I taking certain medications? Do I want to see particular doctors, or do I want to go to a particular hospital?
Step 2, after you've figured out what your health care needs are for your family, then take a look at your financial situation and how much you could afford to pay every month for health insurance.
Develop your budget so that when you are looking at plans and you go through the eligibility process, you will know which plans are most affordable for your family.
Keep in mind that for just about every Arkansan getting insurance from the public marketplace, there is financial assistance.
The more money that you make, obviously the less assistance that you get, but there's going to be assistance available for almost all Arkansans.
Step 3, call and talk to someone and get help. And yes, they'd love to talk to you.
As we began to prepare and make plans for the enrollment period, it was really important that we conduct research with Arkansans. And Arkansans across this state told us they wanted to hear about the health insurance marketplace, then they were going to research it, then they wanted to talk to someone.
These folks are licensed, they are trained, and they are licensed to assist. And they're going to explain all these insurance terminology.
Step 4, get your documents together before you enroll either online or in person. And here's the thing, you don't need that much.
So it would be a really good idea to have maybe your 2012 tax return or your W-2s, a pay stub, something that can support your information. You also will need the Social Security numbers of those that are in your household.
Step 5, get in. Either enroll online or in person.
The enrollment process, once you have selected the plan, will be fairly quickly, because basically you say, this is the plan I want, and you enroll in it.
All right, Craig, thank you. And you have until late March to enroll. For information and resources on how to enroll, visit thv11.com, or you can call right now to get your questions answered. Liz Massey with our phone bank workers. And how's it going in there, Liz?
Oh, it is busy, Dawn. Members of the Arkansas Insurance Department on the phone since 5 o'clock nonstop. As soon as they answer a call, they answer your questions, put the phone down, and the phone is back ringing. In fact, I've been told one person waited 45 minutes just to talk to some of our experts here. Some of the questions, am I eligible? How do I get insurance? What are the penalties? I make this much. I have a child. I'm this age. A lot of people say they're just grateful for the help. They're overwhelmed. Again, our experts will be here until 7:30 tonight. The number is 244-4510, the number on the bottom of your screen, and we'll check back with them in just a little bit. Dawn, to you.
All right, Liz, local business owners say they're also anticipating big changes for their shops as the new health care plans roll out. We'll hear from Walter Burgess, Vice President of Power Technologies, next, and what he's worried about now. For many businesses, uncertainty remains as the open enrollment begins. For others, healthcare will go on as planned. THV 11's Dustin Wilson spoke with area businesses about the Affordable Health Care Act and how it will affect them.
As vents roll off the assembly line, Lamanco CFO Jim Byrd gets ready for the possible effect of the Affordable Care Act.
It's a very complicated act. There's pluses and minuses to it.
Lamanco covers all healthcare costs for their more than 200 employees, so generally speaking won't be directly impacted according to Byrd, but will see changes indirectly.
There are going to be significant fees that are going to be assessed that are basically charged to our insurer that will be passed on to us.
Businesses with 50 or more employees will have to meet minimum requirements in order to avoid a fee in 2015. Walter Burgess, Vice President of Power Technology, says his company already meets the minimum standard and won't see direct change, but he worries the plan could force other businesses to make tough decisions.
What I fear is that a lot of the employers are going to choose to make changes in their business and only have part-time employees. And in that case, you're going to have employees that have 2 or 3 part-time jobs that aren't going to add up to the wage they would receive pre-Obamacare working full-time.
While Burgess opposes government-run health care, Byrd says he's still unsure what to expect with the Affordable Care Act in the long run.
People that hadn't had coverage in the past, that it should drive down medical claims and medical costs. Again, that's like anything, that's kind of speculation, I would think, at this point.
Byrd says if the company decided to pay the fee and drop its coverage plan, they could cut 1/3 of costs, but the employees' coverage would suffer. He says they have no plan to change their current plan. And something many people haven't realized yet, how much young people are being affected by this. Craig O'Neill with more on this live tonight at the Clinton School. Craig, hello.
With my new friend, Chet Howland, who is a student here at the Clinton School of Public Service. And Chet, you've started the ball rolling now. How old are you, first of all?
I'm 25 years old.
What has surprised you about this, or has anything?
Nothing really. I mean, more surprised by the attendants seemed very knowledgeable about the process. People have been in and out of the door pretty quickly. It's been fantastic so far.
How much are you aware of the fact that your age group, you're right in the middle of the age group, that is a key to the success of this law? Is your generation or is your peer group aware of that?
I'd say, the students here at the school, I think we sort of view it as a civic duty to do our part and sign up for this healthcare bill. We'd like to see it be successful. I think there's the potential for this to do great things for a lot of Arkansans.
Now, did you all talk about it? Has this been a topic of conversation with your peer group?
Definitely topic of conversation at dinner and the like in the past few weeks. It's, definitely something that we haven't been used to, this sort of opportunity for, I think half the kids here are probably uninsured, and that's certainly exciting.
Good luck on your career at the Clinton School, Chet.
Thank you.
Chet Howland, who's actually from North Carolina, second year here at the Clinton School of Public Service. By the way, our phone bank at THV 11 will open until 7:30. The phone bank at the insurance department, which has been answering questions all day, closes at 7. We're here at this kickoff till 7. More on the way on THV 11. And with this special, Making the Right Choice, stay here.
Hey guys, welcome back. We're here at our THV 11 phone bank here at the THV 11 studios. Behind me, you can see members of the Arkansas Insurance Department. They are answering your phone calls, taking your questions. They've been here since 5 o'clock, and I have to tell you, they have been on the phone nonstop. Once they answer your question, they put the phone down and the lights start blinking again, asking questions. A lot of people asking, am I eligible? How do I get the insurance? What are the penalties? I may make this much. I have a child. What about this? I'm this age. A lot of people tell me that they are grateful for the help, but they are very overwhelmed here. Now remember, our experts are going to be here until 7:30 tonight. The number on the bottom of your screen, 244-4510, 244-4510. And our panel of experts here looking at your questions, answering your questions. For now, let's head over to Craig O'Neill. He has more on this Affordable Health Care Act. Craig?
Skip Rutherford, the Dean of the Clinton School of Public Service, joins me now on this big kickoff event. Why did you want to host this here?
Very easy, Craig. We are a school of public service. In hosting this event, we think is public service at its finest. Because today, up to 500,000 Arkansans now have a chance to have affordable health insurance. This is a big day.
It is. I'm interested in the students' take. You talked to the students about this whole process, I'm sure, from the time the law was born and the controversy that it passed, but you've also seen it advancing to this day. What are they saying?
Well, over the years as dean, one of the big issues that I've had to face is a lot of students that don't have health insurance. In fact, it's the issue that keeps me up at night because we have a lot of students in years past who simply could not afford health insurance and were sick. And it was a challenge, and it remains a challenge. But let me tell you what's better. Because with the Affordable Care Act, a lot of our students, particularly those under the age of 26, can stay on their parents' insurance. And today, those students that are above age 26 or are not on their parents' insurance or have a pre-existing condition, which are factors in all of our students, they can have health insurance. This is a big deal for them, and this is a big deal for the school. It's a big deal for higher education.
Which is why the kickoff was held here today. Skip, best of luck to you in the future.
Thanks, buddy.
All right, we'll be back with more of this special, the Affordable Care Act, the right choice. Stay here.
All of the information we covered tonight and more online at thv11.com. Click on the Affordable Care Act at the top of the page, and there you'll find more explanation of the federal health care plan, the stories we've done on this topic, and helpful links. The links can help you calculate your healthcare costs and take you to the healthcare marketplace exchange to enroll. Again, that's thv11.com. Click on the Affordable Care Act. Thank you for watching this special presentation. I'm Dawn Scott, and we'll be back at 10 with your local news and weather.
Thanks for watching THV 11 News. Stay connected to the THV Information Center 24/7 on your mobile device and with the THV 11 app for your iPad.